This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
So here we are, just a few days into February, which is Heart Month. Heart surgery is something that can certainly be scary to talk about. Take it from me, okay? It's an intimidating procedure to say the least, yet one that is imperative in most cases.
Yeah, and residents of Delmarva in need of cardiac surgery have been able to have operations done close to home since the late 70s at Peninsula Regional Medical Center. Over the years, the procedures have evolved and improved. Here now to give us some more insight is Dr. Zach Baker. He's a cardiothoracic surgeon at PRMC. So before we get into the surgery itself, let's talk a little bit about what you do. What does a cardiothoracic surgeon do?
Sure. So cardiothoracic surgeon is someone who's been trained specifically to operate on the chest. So anything within the chest. So primarily at PRMC we do heart surgery, as well as lung surgery.
So I guess over the years there have been some changes in everything.
A lot of changes. Specific to PRMC, they have been doing heart surgery, open heart surgery since the 1970s, as you alluded to. Over 15,000 operations have been performed at PRMC, and that's open heart operations.
Right.
And then the evolution of heart surgery, especially in the last even 5 to 10 years, has taken a big swing to now where we do valve surgeries via a catheter, where we don't have to open up your chest. So certain patients in certain circumstances can become candidates for what we currently do called TAVR or TAVR, which is a catheter-based aortic valve insertion.
That's incredible.
So we don't have to open your chest in those circumstances.
So what's a multidisciplinary team, and what does that approach mean for the patient?
Well, it's good news for the patient, and I think medicine has taken a shift in recent years to becoming more multidisciplinary. We see it both with our heart as well as our lung teams, and basically multidisciplinary refers to multiple physicians involved in the treatment of a patient as opposed to one physician treating one patient. So for example, with lung surgery, we have the surgeons like myself, we have the oncologists or the cancer doctors, and every week we have a meeting where we review certain cases and certain patients and get multiple eyes looking at it from each specialty. So I see things from a surgical standpoint, they see things from the chemotherapy treatment or the radiation treatment standpoint, and then we sit and we discuss and try to come up with the best plan approach for individualized patients. From a heart standpoint, we do the same thing, primarily with the surgeons, the heart surgeons like myself, as well as the cardiologists, and we have multiple eyes looking at a certain case or a certain patient, and then obviously involving the patient in the decision-making process of, you know, what is the best course of action.
Can you share some of the more cutting-edge procedures and things that you're doing at PRMC?
Most certainly. So we, as I alluded to, the TAVR, the TAVR procedure, which we've been doing, I think, in the past 5, 6, 7 years, and really in the country, it's only been around, you know, no more than about 8 to 10 years. We've done, I think, close or just over 500 of them.
Wow.
We do a little over 100 a year is what our kind of rate is now, and this is the catheter-based aortic valve replacement.
All right, for a stupid guy like me, explain to me what that means.
So in the heart there's valves which control the blood flow and the direction of blood flow. Well, those valves can get diseased.
Right.
And one of the most common diseases that happens, especially in the elderly, is what's called aortic stenosis, where the aortic valve, or the last doorway out of the heart, the door doesn't open very well.
Right.
It becomes stenotic. And so similar to how the cardiologists open up a blockage in a coronary artery or in the artery in the heart, we can go in and open up that blocked valve with a very large stent, and inside that stent is a new valve that immediately takes over working once we deploy it.
And before you had to do that with open chest surgery.
Correct.
But
Yep.
not now.
Not now. Now we can do it with catheter-based techniques. And in the recent years, this has actually been through FDA approval to become more and more available to all patient populations, as opposed to what it started out with just high-risk surgical patients.
Okay.
Now, most patients can become candidates for the catheter-based technique.
And that means patients here on Delmarva can stay here on the shore.
Correct.
And there's many advantages to that.
There is. I think staying close to home, I think one of the biggest things with that is you have your family and friends nearby, because the recovery process is as important as going through the actual surgery. And having friends and family there to support and being close to home, I think, is extremely beneficial. And yeah, we can perform most anything that they can do across the bridge.
Which is fantastic. We are so proud to have PRMC here on the shore, but to tell you the truth, I really don't want you to have to do that. What would you give us as your best advice for us to stay heart healthy?
I think the biggest thing is be preventative. Lifestyle modification, so stop smoking, eat a little bit healthier. And then part of that, and part of being preventative, is maintaining and establishing a relationship with a primary care physician who at least yearly, checks lab work and does a physical exam and makes sure you are leading a healthy lifestyle. And unfortunately, well, not just in Delmarva, but in the U.S. and in the world, people we're not very good at preventative medicine.
Right.
We see a lot of patients who haven't seen a doctor in 10, 15 years. Their medications, they may not be taking any, or they're taking the wrong doses, or they're taking too many, or whatever. So being preventative, lifestyle modification, as well as following up and doing established care with a primary care physician.
All right, good advice, Dr. Zach Baker.
Thank you so much. Thank you.
PRMC,
Good
thank you
stuff
so
there.
much.